welcome everybody, but thank you. Welcome everybody. This is the third session in Rabbi Reifman's three-part series. I see a lot of returnees, so I'm not going to do a whole introduction, but just thank him from the get-go for the last two sessions, which were really enlightening and terrific, and I'm sure this one will be as well. And welcome also, just if I might, to I see those who joined as panelists, to Bert, welcome, and to Rav Levi. Nice to see you. I've seen you for 2 years, maybe. And to Rabbi Rabin. Did I get it right this time? Okay, welcome to you as well. Okay, Rabbi Reifman, handing it over to you.
Thank you very much, and welcome back to everybody. Welcome to all the familiar faces. I want to pick up where we left off yesterday. We had covered the first responsum of Rav Moshe Feinstein, who again we refer to simply as Rav Moshe, where he rules that organ transplants are heart transplants, that's what he's writing about, or cadaveric organ transplants in general are considered to be murder of both the recipient and the donor. And that was his initial response to the first human-to-human heart transplant in 1967. In his 1970 tshuva, and of course in his 1968 tshuva, responding to that first incident, he didn't explain himself. He simply said they're double murder because the doctors are lying and the donor is not really dead yet. And the recipient also is likely to die, and therefore they're essentially killing the recipient as well. And he left it at that because he said he didn't want there to be any debate about this issue. I will add just briefly that this is something that one sees in a number of ways in Rav Moshe's writings about medical topics, namely that the imperative to save lives takes precedence over in halakha takes precedence over virtually all other issues, but becomes a particularly burning concern for Rav Moshe when he's writing about issues that are effectively kind of public policy. Would for Moshe said that something would be permissible, or as I mentioned in the last session, is encouraged, as he did with live organ donation, then it was something that the Jewish community came to value or to consider to be prohibited. In other words, he had enormous sway in terms of how he crafted a Jewish attitude towards all sorts of medical issues. And therefore here, I don't think we need to see his position or his initial response to organ transplants from cadaveric donors as suspicion of medicine or as dismissal of modern medical technology. He's really just concerned for the fact that these very new procedures were causing people to die. And therefore, in that context, and we had started developing this line of thought last night, as we see his thought develop through the 1970s as a medical understanding of the process of death and the state of brain death develops, we see his position evolving and eventually coming to the point where, as I mentioned last night, in the 1980s, he did authorize people to be recipients from cadaveric organ donors, and there's good evidence as well, as we'll talk about today, that he endorsed what is now accepted to be, or the standard that's accepted to be, brain death in the medical community. His 1970 tshuva, his 1970 responsum, is the one that we finished off with last night, and we were not quite finished. I left you kind of with a cliffhanger, where effectively he says through most of the tshuva that the relationship between three critical organs, the brain, the heart, and respiration, is as follows. The brain and the heart are those organs that are most critical in terms of providing life force to a person. What is the significance then of breathing? Breathing is the most visible and the most sensitive indication that the brain and the heart are giving life to the person. In other words, respiration is an indicator of when the brain and the heart are providing life to the person. It is not independently significant. When the Gemara, for example, talks about the nose, it's not that the nose is some critical organ. The nose is simply the most sensitive indication that the brain and the heart are providing life to the entire person. That seems like a very kind of naive or simplistic model of the body. He doesn't, in fact, talk about any of the physiological phenomena that undergird that conceptual structure. What does the brain do? What does the heart do? In part because Rav Moshe's medical knowledge was not actually all that sophisticated. What we're going to do today is see the wisdom in that very simple conceptual structure that he develops. And in fact, why it's not intuitive at all, and in fact is something that I think is an important factor that can inform some of the broader bioethical discussions that go on around brain death and around the permissibility of cadaveric organ donation. Let me just highlight again in this file that I've shared with you this line here, because it's a critical line insofar, as I said last night, that Rav Moshe repeats it 3 times in the course of his response. It's abundantly clear that the nose isn't the organ that gives life to a person, nor is it the organ on which life depends. Rather, the brain and the heart are the organs that give life to a person. Excuse me. Enable him to breathe via the nose. And the nose is only the organ for which occurs the respiration, excuse me, that comes from the brain and the heart. Okay, so this is the line that I want to highlight. We're going to come back to it a couple times in the course of our shiur tonight. We had left off at the end of the responsum where he was addressing a point that his questioner, this is, of course, a responsa means you're actually responding to somebody. In this case, Rav Moshe was responding to a question asked to him by Rav Chaim Berglevsky. And he says as follows, and I don't understand on what basis you concluded. Okay, he's referring to Rav Golevsky's question that he doesn't cite explicitly except for this passage. It emerges that for the Chacham Tzvi, the Chacham Tzvi was an important Halakhic authority in the late 17th and early 18th centuries, that there is but one indication of life, and that is the heart. So according to this, an individual whose heart is beating is considered alive, and an individual whose heart has stopped is considered dead. One reading of this responsum of the Chacham Tzvi that Rav Golevsky is referring to here is that the heart is the sole indicator or the final indicator of life, and therefore, as long as somebody's heart is beating, they're necessarily considered alive. If so, what's the significance of breathing? The Gemara talks not about cardiac function, but about breathing. So he explains as follows, that without respiration, the heart cannot function, causing the individual to die imminently. In other words, the way that Rav Golevsky accounts for respiration and the significance of respiration is that respiration, breathing, is needed for heart function. And therefore, when breathing stops, the person's heart will eventually stop beating because, like all muscle in the body, it requires oxygen in order to function. In other words, the direction of causality is breathing is the cause of heart function, and without breathing, the reason the breathing is significant is that it causes the heart to stop functioning. This is a critical point because if you think about what this is saying about patients who are artificially respirated, is respiration is actually not significant at all. A person's ability to breathe independently stops being important as long as we can supply the body with oxygen in some other way. And if, in fact, Rav Golevsky is correct in saying that a person is alive as long as their heart is beating, then it doesn't matter how they're getting oxygen, as long as the heart continues to beat with the oxygen that we provide them with, or that they can intake on their own, then they're still alive. In other words, in the model that Rav Golevsky has developed here, artificial respiration essentially takes the place of independent respiration or autonomous respiration. And Rav Moshe is about to push back on this, okay? This opinion that Rav Golevsky presents here is actually one I could say one prominent, I was about to say dominant, but I don't actually think that's true. One prominent position within the Halakhic community, and less prominent, but still exists in the broader bioethical community. Namely, that as long as the heart is beating, the person should still be considered alive. This obviously has very significant implications for the permissibility of cadaveric organ donation, because up until fairly recently, it was virtually impossible to harvest an organ from a non-heart beating patient. If we waited for the heart to stop beating, and typically you had to wait a minute or two to make sure that it was really not beating at all, by that point, the heart would have stopped, or actually a couple of minutes longer than that. The organs would have degraded to the point where they were no longer functional when they were transplanted from one body into another. In the previous session, Alan Septimus, who joined us at the end and is a kidney recipient, mentioned that his first kidney that he received from the cadaveric donor was severely scarred because his donor had had a stroke. Okay, when you think about what it takes to harvest organs, or what kind of patients you can harvest organs from, it's patients who have not had any significant physical damage aside from their head. It's typically accident victims, other people who have undergone some sort of sudden death that has not impacted the rest of their body. We're thinking about this now in Israel, of course, because when soldiers are injured in certain ways in the battlefield, a number of soldiers' organs have been harvested when their families have acquiesced, and thereby in death have managed to save many lives. In any case, Moshe is about to push back on this position, and this is the first clear indication that we have that Moshe does not accept the cardiac definition of death, that he's going to view the relationship between cardiac function and respiration differently. Says Rav Moshe, for this isn't the intention of the Chacham Tzvi, but rather, as I wrote above, the heart provides life force to all the organs, and even nasal respiration is enabled by the heart. Okay, Ramosha says, reverse the direction of causality here. It's not that respiration is significant because it supports cardiac function. It's important because cardiac function supports respiration. The significance of breathing is that it demonstrates that the heart continues to function. And here's where heart function, as we said last night, is not necessarily exactly synonymous with heartbeat. Hold that thought, and we'll come back to it in a minute. When the heart stops functioning, says Rav Moshe, completely, all limbs stop moving, and breathing through the nose stops as well. In other words, what does respiration tell us? It tells us that the heart is still functioning and providing life force to all of the organs of the body. And when the heart stops functioning, all of those life functions cease, including respiration. But as long as the heart is functioning, even with great weakness, such that the rest of the limbs aren't moving, life is still present in respiration, since the nose is the last organ to cease. I want to highlight this line as well. In other words, as long as the heart continues to function, we know that because the rest of the body also continues to function. And the last indicator that the heart is providing life force to the body, the definitive indicator, is breathing. Okay? Questions just on this. I want to make sure that this is clear. Rav Moshe views respiration as an indicator that the heart is providing life force to the body, but it's the definitive indicator. In other words, it's the one that is the final indication that the patient is still alive. When respiration stops, then we can be sure that the heart is no longer providing life force to the body. Questions just on this. Levi.
Would it be fair, when I was reading Rav Moshe here, my sense was that he's attaching to respiration as the siman, and that he doesn't want to touch the siba question at all.
Okay, so that's very apt terminology. I wanted to explain the terminology that Levi's used, which is kind of a traditional halachic terminology. And I want to actually translate it into medical terminology. Siman means what? It's an indicator rather than a cause. In other words, it's just something that shows what's happening somewhere else. What do we call that in medical terminology? A symptom. We use symptoms all the time when we're diagnosing things. A rash is typically not the cause of the disease and may, in fact, maybe it's itchy, maybe it's not itchy. It's not typically not the thing that we're worried about. When a dermatologist or another doctor sees a rash, that's often an indication, a symptom of some other problem in the body. This is basic medical terminology. He is not really addressing the siba, which is the cause, because again, Rav Moshe is not really well-versed enough in medicine to articulate that. And in fact, you'll notice that he does not talk about physiological phenomena here. He doesn't talk about circulation. He talks about heartbeat, but here he doesn't use the term heartbeat. He talks about heart function, which is really not a strictly medical term. And he talks about life force, which is definitely not a medical term. Again, it sounds like he's lifting that out of Star Wars. Why is he doing that? I think because he does not want to be too specific. He's talking more generally about the state of life. And therefore, yes, I don't think he's being overly specific. What's clear, though, is the direction of causality. The heart is providing life force to the body, including the lungs, or including the respiratory system. The respiratory system is the final indicator that the heart continues to provide life force to the body. Okay? Based on this, okay, we're going to take a big step forward here, and you'll see how I'm going to articulate this in conjunction with the next tshuva as well. Based on this, what could we say for Rav Moshe? Let's say the patient is no longer capable of independent respiration. Well, based on what Rav Moshe just said, we would say the heart is no longer providing life force to the body, because if it were, the patient would be able to breathe. Is that true even if the heart is still beating? Can we say that the heart is still beating but no longer functioning? Yesterday, I made a point of saying that in the previous paragraph, Rav Moshe seems to distinguish between heartbeat and heart function. Heartbeat being the physical beating of the heart, the physical expansion and contraction of the heart muscle, and heart function being the fact that the heart provides life force to the body. Those two things are not necessarily the same, even though they typically coincide. We can say it in one direction. Rav Moshe suggested maybe the heart could function, giving life force to the body, even if it's not beating. And we said that was probably not the case. And Rav Moshe acknowledged that was unlikely. But here I think Rav Moshe is pointing at the opposite phenomenon of the heart possibly beating, even though it's not actually functioning. He doesn't say that outright. But what he said in this last sentence opens the possibility that if the breathing has stopped, if the patient is no longer capable of independent respiration, then maybe we would say the heart has stopped functioning, even if it's still beating. This, in fact, is a fairly simple but accurate description of what happens in somebody who is considered brain dead based on contemporary standards. They're being artificially respirated, their heart continues to beat. The neurological systems are no longer supporting various functions, including respiration, and therefore we might say that they are considered to be dead based on Halakhic criteria, even though the heart is still beating, because the heart is no longer capable of supporting the body's respiration. One could say such a thing, in which case this would pave the way towards accepting brain death as a halakhically acceptable standard of death. So far, so good. Levi, again.
I'm having trouble hearing that reading in the formulation at the beginning of the paragraph. V'gam zeh she'ika inyan hanashim al yedei ukeshaposek halev mila avod hanashima. Ukeshaposek halev mila avod legamre. That yes. The word legamre is giving me trouble.
True. Fair enough. And let me say that I don't think Rav Moshe is actually saying that here. I've interpreted this Hebrew term, ukeshaposek halev mila avod, to mean that the heart has stopped functioning completely, but you don't necessarily need to read it that way. You could say La'avod refers to the physical phenomenon of beating. I don't think Rav Moshe is actually commenting on the phenomenon that I've just spoken about, namely where the heart is beating but no longer supporting respiration. All I'm saying is this opens the door to potentially talking about that, and I think it's helpful to consider that based on what we'll see in the next response. Okay? Okay, let's push ahead and then we'll come back to this, and I think gradually everything will become clear as we continue putting this picture together. The third responsum actually that we're going to read, as I said, was written in 1976. This was addressed to Rav Moshe Feinstein's son-in-law, Rabbi Moshe David Tembler, Zatzal, late of the Monsey Jewish community, where he was a leading rabbi and posek for many, many years. He also taught biology at Yeshiva University. And Rav Moshe David Tembler was responsible for helping Rav Moshe work through many different kinds of medical issues, because, of course, as a biologist, he did have the necessary understanding of what was going on. He poses this question to Rav Moshe in 1976, and at a point when, as I said yesterday, heart transplants were still not being done worldwide. There was a worldwide moratorium on heart transplants because anti-rejection drugs had not been developed, and therefore most heart transplants ended in the death of the fairly rapid death of the recipients. The question here is not about cadaveric organ donation. It's about diagnosis of death in various kinds of circumstances. And this is a much different, very different in style than the previous tshuva, in the sense that this is much more clinical, this is much more practical, and Rav Moshe is finally going to address some basic practical questions and lay down some basic distinctions in a way that he didn't do in the previous response. On the matter of determining when an individual is considered dead, it's stated explicitly in the Gemara Yoma that if a building collapsed on an individual, that we clear the heap even on Shabbat and uncover enough to examine his nose. For if they don't detect any life upon checking his breathing, he's considered dead. But even if the breathing is very shallow, he's considered alive. And one can detect this with a feather or a thin piece of paper placed by the nose. For it doesn't move, he's assumed to be dead. Again, what's Rav Moshe's starting point in this tshuva, and is it consistent with what he said in the previous tshuva? What's the standard of death? Or what's the criteria? What's the diagnostic criteria that we use to determine life or death? Breathing. And he gets that very simply from the sugya in Yoma, from the passage in Yoma that we read 2 classes ago. This is, in fact, exactly what he said at the beginning of the previous responsum. He said, the truth is that cessation of brain function isn't death, since as long as one is breathing, one is considered alive. Again, throughout the second tshuva, throughout the 1970 tshuva, he kept coming back to this point that the one and only definitive criterion for determining is breathing. That will get a little more complicated in the context of this tshuva, but not that much more complicated. In other words, Rav Moshe is sticking to a very basic point, which is that respiration is the defining criterion for determining life and death, and that he gets that very simply from the sugya in Yoma that we learned 2 days ago. Conceptually, and also in terms of his source material, Rav Moshe is very, very straightforward. But they must perform this examination, he continues several times, as I explained in Rav Moshe Yoredea 2174, in explaining the words of the Rambam, who wrote that one must wait a short time in case the deceased has only fainted. Again, how do you know whether cessation of respiration is temporary or permanent? You have to wait. You have to make sure that you didn't just miss something. You're not breathing very shallowly in a way that you can't detect. You have to wait and make sure that this is really permanent. Meaning the amount of time it will be impossible to survive without breathing. Okay? That's the standard procedure and was for much of Jewish history, for much of human history. All this is in reference to terminally ill patients who don't require a ventilator. But there are patients who can't breathe independently and are placed on ventilators, which enable them to breathe even if they are already dead, since artificial breathing doesn't render one alive. I mentioned yesterday when somebody asked, couldn't he in his 1970 tshuva be referring to a case of somebody on a respirator? And I said, no. And I said, there's no indication in that tshuva that he's talking about artificial respiration at all. In fact, there are several indications that he's not. This then is the first time that Rav Moshe addresses the phenomenon of artificial respiration directly. What does he say about it? First of all, it complicates things because now it's not clear how you determine whether they can breathe independently or not. Okay, so we'll talk about how to diagnose that in a minute. But the more important point is he does not think that artificial respiration is equivalent to independent autonomous respiration. He says again, artificial respiration doesn't render one alive. The fact that we've developed machines that can substitute for physiological functions, it's true, they can provide the patient with oxygen, but that doesn't mean that they are considered to be breathing. This is actually not such an obvious point, because what could you say? What's the definition of breathing? What does it mean to be able to breathe? You could say that means, sorry?
I was going to say exchange of gas.
Exchange of gas across the lung membranes, right? You could say that as long as you have intact lungs, it doesn't matter what is causing the air to enter your body, as long as the gas can be absorbed, the oxygen can be absorbed by your lungs, maybe that's enough to say that you are breathing. In fact, there are Halakhic authorities who say that this is in fact the case. Maybe even if somebody is being artificially respirated, they're still considered to be breathing on their own because their lungs are still intact, and that's what's enabling them to absorb the oxygen. It is not like, for example, if we supplied oxygen intravenously, if one can do such a thing. I don't even know if that's possible. In other words, the process of breathing is still very much like what could be done if you were breathing independently, meaning drawing air into your body through the movement of your muscles. And yet Rav Moshe says it's not the same. Okay, and that's a critical point. Rav Moshe dismisses the idea that artificial respiration is equivalent to autonomous or independent respiration. We'll come back to that point in a couple of minutes. Regarding such patients, if there are no other indicia of life, for the patient seems completely unresponsive even to a pinprick, like the state referred to as coma, as long as the ventilator is attached, it's forbidden to remove it from his mouth, lest he is still alive and this will kill him. So here's the complication. If they're being artificially respirated, how do you know that they can't breathe on their own? Earlier, he said, well, you just wait to see if they can breathe on their own. But what would happen if we did that? What would happen if we were to detach them from the respirator, remove it from their mouth, and wait? It could be that they can breathe, just not enough to support they can't breathe deeply enough or strongly enough to support themselves. And therefore, by removing the respirator, you would be killing them. Okay, this gets us into a separate question about what kinds of treatment you need to provide to somebody who is in an end of life in an end of life scenario. Moshe, in fact, does say that you need to provide oxygen, other kinds of treatment, and other medical support are more complicated issues. But he says you need to provide them with oxygen as long as you don't know if they're still alive. So how can you do this? So he continues, but if the ventilator stops working because the oxygen runs out, okay, he was dealing with ventilators that use oxygen tanks that need to be replaced, they shouldn't put him back in his mouth for a very short time, approximately 15 minutes, at which point, if he's no longer alive, he will have stopped breathing and they will be certain that he is dead. Says Rav Moshe, you can't actively detach them from the ventilator, but you can wait for the oxygen to run out and then passively not replace it until you see whether they can breathe independently. And he says that's an acceptable way to determine whether a patient who's being artificially ventilated is able to breathe on their own. Questions just on this. Aside from the most obvious one, which is what do we do nowadays? We don't use, for the most part, ventilators that require oxygen tanks. Most medical centers, at least in the developed world, have a constant flow of oxygen, and therefore you would be able to wait until the tank ran out and be able to passively wait until you put it back in. And therefore, what do we do nowadays? What's the solution we use nowadays? Larry, are you familiar with this?
Are you talking about not hanging the next bag of pressers?
The truth is that there are a number of ways of determining this. There are no, I mean, again, there may depends on the way the patient is being ventilated. One of the techniques that I've heard is using is inserting a thin tube a thin tube inside the respirator tube that carries pure oxygen, and then you can see based on gas exchange if the patient is breathing independently, how much CO2 they're putting out, et cetera. In other words, there are techniques that we can use nowadays, even as they're being artificially ventilated, to see whether they're capable of independent respiration. You don't need to disconnect them from the ventilator.
Hi, this is Bert. I can't see how to raise my hand here.
Go ahead.
Okay, here's the thing. There was a situation where a friend of mine had a child who had suffered brain death. This is in West Hempstead. But he was still breathing, as it were. Obviously, he didn't die completely. His breath was, and Rabbi Kellemer, who was the guiding force here, said that they should try and disconnect the ventilator, or the oxygen, for brief periods of time and see if he breathes on his own. And I don't know how that figures into it. How long after you remove it does the body stay, healthy, as it were, for transplant purposes? That's A. And B, how long do you have to wait, according to Rav Moshe, to um, practically disconnect the thing, permanently?
Okay, I don't want to get into the technical side, also because I'm not actually that familiar with the medical procedures. Maybe we'll let Levi or Rabbi Rabin jump in at a later point to weigh in here. The details are less significant than the bigger picture here that I want to focus on, which is Rav Moshe points out that artificial respiration complicates the diagnosis of cessation of breathing, but doesn't make it impossible. There are various ways to do that nowadays, and it will really depend on the patient. Again, there are poskim, there are Halakhic authorities nowadays who say that artificial ventilation is not something you need to provide as end-of-life care, even if the patient is still alive. Rav Moshe doesn't hold that way. He thinks that oxygen is something you need to provide, but not everybody agrees, and therefore different poskim may have different takes on this issue. What I think everybody would agree on is that you need to assess whether they're capable of breathing on their own, because you mentioned that their child was tragically diagnosed as brain dead, but could still breathe. That can't be true on a technical level, because nowadays the diagnosis of brain death requires, even from a medical perspective, forget about a halakhic perspective, requires that somebody not be capable of independent respiration. If they're capable of breathing on their own, that means the brainstem is still functioning, and therefore they're not considered to be completely brain dead. Yeah. Rabbi Rabin?
Sorry, just to chime in just on a quick medical note, since you mentioned it, which is that the sort of standard procedure in most hospitals today is a progression of tests to test for brain death. That sort of is a clinical examination where you look for different reflexes. It progresses from pinching your nose to something much more painful. After that is what's known as an apnea test, which is essentially seeing what the body can, whether or not the body can still function without it. So unlike when Rav Moshe was writing this, it's sort of progressed to a stage where it's, let's say, 8 or 9 steps that you're checking before you've declared this person brain dead.
Okay, thank you. Thank you very much. And again, we'll talk about some of these issues as we go forward, in terms of the certainty of these kinds of diagnoses and the procedures that are put in place to make sure that mistakes are not made. Occasionally one sees in the headlines that somebody who was diagnosed as brain dead suddenly popped up and sat up on the operating table. Such cases are rare and cause for concern, but do not rule out the fact that brain death is still widely accepted and reliable in the vast majority of cases. Okay, let's keep going, because the next paragraph is the really critical one. But all this is in reference to people suffering from a disease. But regarding those who are injured in a car accident, you'll notice in one of the endearing things about Rav Moshe's writing is that he, when he comes across a modern term, he often writes it, he transliterates in Yiddish, be'accidents al yedei hakars. It may occur that they can't breathe due to the contraction of nerves near the lungs and respiratory organs. But after breathing for some time by means of a ventilator, these contracted nerves will expand and they will begin to breathe independently. Okay, again, leaving aside some of the medical terminology here about nerves being contracted and whatnot, what's Ramesh essentially describing here? A patient who's respirated artificially, not because of a permanent condition or a permanent inability to breathe, but a temporary inability to breathe. In other words, preventing them from breathing after an accident may be some sort of physical contraction of the lungs or of the rib cage or something else about their body. And until the body heals, they need to be artificially respirated. What do we do in such a case? Because in this case, what would happen, as he writes in the next line, regarding these individuals, even if they can't breathe independently and no other indicia of life are visible, it's possible they're not considered dead. Why is that? Why don't we just say, oh, they can't breathe and therefore they're considered dead? Isn't that what we talked about in the Gemara and Yoma? Well, as we said in the Gemara and Yoma, in the time of the Talmud, they didn't know and didn't have the techniques to revive somebody who was incapable of breathing. They didn't have mouth-to-mouth resuscitation or CPR, and certainly they didn't have artificial ventilation. And therefore, when we talk about assessing whether or not they can breathe, what we mean is whether they can breathe, whether their cessation of breathing is permanent or temporary. Sorry, hold on 1 second. And therefore, he says, if somebody is in this situation where you see that they were in an accident and their body is damaged in a way that they might yet recover, you can't simply see if they can breathe independently by waiting for the oxygen tank to run out or doing any other kind of test like that. You need to wait for something else. You need to figure out not only whether they are breathing, but also why they can't breathe. And here he points to a specific medical procedure which Tendler had recommended. And since you say that now there's a test with which expert doctors can determine by means of injecting a radioactive nucleotide solution into the blood vessels, okay, a contrast solution, which is used for doing a CAT scan, whether the connection between the brain and the body has been severed. For if the radioactive solution doesn't reach the brain, it's clear that the brain has no more bearing on the body, and also that the brain has lysed completely. And it's as if the head was forcibly severed from the body. What test is he recommending here? This is called the radioactive nucleotide scan. They inject a contrast agent into the bloodstream and see via CAT scan if it can reach the brain. If there's no longer blood flow to the brain, this test reveals that essentially the brain is no longer functioning vis-a-vis the body, and therefore, says Rav Moshe, we can consider this patient who is not capable of independent breathing to be dead. In other words, what is Rav Moshe endorsing here for the first time? A neurological test or a test of neurological function to see whether the patient is alive or dead. Doesn't this contradict what he said in the previous responsum? Doesn't this contradict what he said in the previous tshuva where he said, going back up here, the truth is that the cessation of brain function isn't death, since as long as the patient is breathing is considered alive. Rather, the truth is the cessation of brain function isn't death. Let's just say that. Doesn't that contradict what he just said? Why is he looking at the brain now in terms of figuring out whether or not the patient is alive? Well, if we look at the next line, he says, rather the cessation of brain function is what causes death, since the patient will stop breathing. Again, why do we care about brain function? Why do we care about whether or not the brain is intact, and whether there's blood flow to the brain to determine whether the patient has brain function? Because brain function is that which supports breathing. Just as we said before that heart function is significant because it supports breathing, it provides life force to the body, which includes the ability to breathe. So too, brain function is important because it provides life force to the body and it enables the person to breathe. The heart and the brain are equivalent in this sense, as Rav Moshe said in this sense. We highlighted it before. It's abundantly clear that the nose isn't the organ that gives life to a person, etc. Rather, the brain and the heart are the organs that give life to a person and enable him to breathe via the nose. Again, the brain and the heart are both the organs that give life to a person, and we need to see if the person can breathe in order to determine whether or not the brain and the heart are still functioning insofar as giving life force to the person. In this case, where the person can't breathe, we need to understand why, because we need to know whether that's a permanent or temporary condition. And therefore, seeing whether there's neurological functioning tells us why that patient can't breathe and tells us whether or not the brain is still providing life force to the body. That's how I want to put these two tshuva together, because it seems to me that Rav Moshe really is working with the same underlying conceptual structure in both tshuvot, in both responsa. And therefore, even though if you point to specific lines in the first 1970 tshuva that seem to contradict this, if you pay attention to the way that Rav Moshe is writing about the brain and also the heart in the first tshuva, it's clear that he's writing about it in the same way here. The brain is significant because it brings life force, gives life force to the body. It causes breathing. Breathing is an indicator of when the brain functions, except in these exceptional circumstances when it's not. And then we have to do what we can to see if there is still neurological functioning or not. Questions just on this? Let's start with this. Are there other conditions that could lead to the kind of situation that Rav Moshe is describing here, where a person is incapable of independent respiration, but we think that might be a temporary condition? He talks here about accidents, a car accident, some other kind of accident that causes some sort of physical contraction or constriction of the body that might lead them no longer to be able to breathe. In other words, there's a physical rather than neurological limitation on their ability to breathe. What else might lead to a kind of circumstance like this? A drug overdose, for example. Chemically, they might be the chemicals, certain chemicals depress the nervous system to the point where the brain would no longer function temporarily, and therefore the patient would not be capable of independent respiration. As soon as the body works the chemicals out, as soon as the blood flushes the chemicals out of the body, the patient will be able to breathe again. Hopefully, one hopes. Hypothermia can lead to a situation like this, and therefore EMTs know well. It's a general rule, you don't declare somebody to be dead until their body comes back to room temperature, because in cases of hypothermia, certain parts of the body can shut down and the patient can no longer be able to breathe, but as the then they'll be able to breathe again. In all of these circumstances, you need to wait, and if you're not sure what's causing their inability to breathe, then you use this kind of test. That's what Rav Moshe suggests. This would indicate. Well, let me make time for questions again. I see there were comments in the chat. No. This is the kind of test that doctors were using in the 1970s, because brain death was an issue not only for cadaveric organ transplants. In fact, at the time, it was not being used for cadaveric organ transplants, but simply to know whether you could detach somebody from a ventilator. Somebody could be brain dead and it would be attached to a ventilator. And again, one can survive, or the body can be intact in that circumstance, in some cases for months or years. And therefore, it's critical for Moshe to define, even at this point in time, when cadaveric organ donation is not being done, to define whether brain death is considered death simply for the question of when you can detach somebody from a ventilator. Okay, and that's the question that Rav Tendler is asking him. It seems, therefore, in this tshuva that Rav Moshe is endorsing the brain death standard because he's accepting this test as a viable test to determine whether somebody is alive or dead. Are we really sure? Can we be sure that Rav Moshe is talking here about the kind of circumstance where people are brain dead? For example, we've said over and over again that a brain dead patient, what does that mean functionally? It means their heart is still beating and therefore the rest of the body is being sustained even as there's no longer neurological functioning and other basic functions aren't happening, like responses, like reflex responses, like independent breathing. Are we sure that's what Moshe is talking about here? Could we read this as talking about a patient who has no heart function as well, and therefore this would be consistent with a cardiac definition of death? Could that be what Rav Moshe is describing here? Sorry for the silence. I want to get somebody's response here. Is that possible? Could you read the tshuva in that way? Because some people do. For those in the Halakhic community who want to, who don't accept brain death as a standard of death, who insist that a standard of death, that a person is not considered to be dead as long as the heart is beating, they have a lot of trouble with this tshuva, and therefore they are forced to say, oh, Rav Moshe must be talking about somebody who's being ventilated, and even though they don't have any heart function, their heart is not beating. Could you say that? Is that a plausible reading of this tshuva? The short answer is no, because nobody ever ventilate somebody who has no beating heart. We might do CPR, we might do other things. You wouldn't ventilate such a patient because within a matter of minutes, they're clearly going to be dead, whether they're dead yet or not. That's the short answer. The longer answer is no, because the test that Rav Moshe is recommending of injecting a contrast solution into their bloodstream and seeing if it reaches the brain relies on a beating heart. If you're injecting something into the bloodstream, it means the heart is beating and the person has circulation. Otherwise, the test is completely pointless. And therefore, it's utterly clear that Rav Moshe is referring here to a patient whose heart is beating, and even so, he considers the patient to be dead as long as they're capable of independent respiration, and we see that that's consistent with the fact that their brain is no longer functioning. Yeah.
Just a question, not to open a can of worms, but since there are major poskim in America and in Israel that do not hold by the brain death standard and presumably are aware of this tshuva by Rav Moshe, like what is there just to give us a moment to help me understand what that argument would be against what it's saying here.
Yeah. Look, here we start. Look, let's take a step back here. Let me just I'll address Rabbi Rabin's question in a few minutes, but let me just take another step back and make sure that what we're saying is perfectly clear. In other words, this paragraph is the reason that when we read the earlier tshuva, I want to say that Rav Moshe could be referring here to a case where the heart is beating, but no longer functioning. The heart is physically beating, but it's not functioning insofar as it is not supporting the life force in the body, which is defined how? By the patient's ability to breathe. Okay, good. If there are questions or the questions come up, please feel free to ask, but this is the most basic point that I want to make. I want to make one other point before we get back to Rabbi Reifman's question, which is what we mean by life force. This kind of vague Star Wars-y phrase that Rav Moshe keeps using. What do we mean by life force? What do we mean, in fact, by life? When we talk about brain death, we're talking, in fact, about the meaning of life in a literal sense. Rav Moshe said over and over again, breathing does not mean life. Breathing is just an indication of life, but then what is life? And I think we have to accept here that life is an amalgam of phenomena, all of which are intertwined. It's the ability of organic organisms to function in a certain way. And we put a label called life on this, but we don't really understand exactly what it is. Life in some ways is a black box, a condition that is more than the sum of its parts, right? It's not just that you have a heart beating and it's the brain functioning and you can breathe. Somehow life is more than that. It's the label we put on the functioning of complex organic organisms. What you realize when you think about that kind of definition of life is any conception of the body necessitates an understanding of the way that every organ is intertwined with every other organ. And to talk about the meaning or the significance of one organ functioning, for example, the heart beating, is meaningless unless you can talk about the function that it serves relative to the rest of the body. A heartbeat in and of itself isn't alive. heartbeat is significant for the life of the organism because of the way that the heart supports the rest of the body. And the same thing is true, of course, about respiration and about brain function. Let's not imagine that our brains have some special quality that makes them unique in terms of being the source of life. The brain is significant only insofar as it supports the rest of the body. The system overall is significant, and no one part of the system is important except in the role that it plays within that broader system. I mentioned before that this tshuva was written to Rav Moshe David Tendler, who proposed this test and asked Rav Moshe if it could be used to determine life, and his answer is clearly yes. And Rabbi Tendler wrote a number of pieces on this issue on his own, including one that maybe we'll come back to in a couple of minutes. But I want to quote an article that he wrote because he says it really quite clearly. Rabbi J. David Bleich, and there's a long-standing debate between Rabbi Tendler and Rabbi Bleich on this issue. We'll come back to Rabbi Bleich in a couple of minutes. Accuses the Israeli rabbinate of relying on respiration as the sole criterion of death. Okay, and that was in fact the definition of death that was accepted by the Knesset by the Israeli rabbinate starting in the 1980s, and then eventually by the Knesset in the aughts. This is now Israeli law, that the definition of life is based on the ability to breathe independently. And Rabbi Bleich, argues on this basis that it would be consistent for them to declare a polio victim dead. Why? A polio patient can't breathe on their own, and therefore, according to this, they could be considered dead. Such an individual cannot and will never, Rabbi Bleich points out, breathe on his own. But for that matter, a person who has a pacemaker could be declared dead by cardiac criteria, because of course it's the pacemaker that keeps his heart beating. All this proves is death is never a matter determined by breathing or heartbeat. The fact that a polio patient cannot breathe, but is yet alive, is based precisely on the fact that he has an organized system. Indeed, it is based on the fact that he has a functioning brain. The question isn't whether a person can or cannot breathe, but only why he can't breathe. Why can a fellow who is under debris and not breathing be declared dead? Because the brain died. Otherwise, we have an obligation to try to revive him using CPR. Okay, etc., etc. In such an instance, the individual suffers irreversible respiratory failure when it stems from an irreversible cause, the death of the brain. Okay, there are really 2 points here, and I want to separate them because Rabbi Tendler, on the one hand, seems to be focusing, at least in the last couple of sentences, on brain function. But earlier on, he points out that respiration is significant and heart function is significant because of its role in the organized system that is the body. Okay, and that's the point I was making about Rav Moshe as well. Rav Moshe views everything as an integrated whole. Breathing and heart function and brain function are significant insofar as they provide life force to the body, including respiration. Respiration is significant because it indicates what's going on in the heart and the brain. Isn't that kind of circular reasoning? And the answer is yes, because you can't escape the fact that a definition of life requires some degree of circular reasoning. No one process, no one organ, no one physiological phenomenon is independent entirely of the rest. And therefore, when Rabbi Tendler gets to the last part of what he says here, where he focuses on the brain, I would quibble with this a little bit too, because even the brain is significant only insofar as it is integrated into the rest of the body. And that's what Rav Moshe said in his 1970 tshuva. The brain is not significant. You can't just look at neurological criteria to determine death. You have to look at the function of the brain relative to the rest of the body, its ability to provide life force to the body, i.e. to maintain the entire body as a functioning, viable organism. Okay? And here we come back to another point that comes up sometimes in the reading of this last tshuva. Rav Moshe, as I said, was responding to Rabbi Tendler's question, and Rav Tendler said, he has written elsewhere, that the definition of brain death is the brain is no longer functioning, that it's lysed completely, and it's as if the head was forcibly severed from the body. This is a point we mentioned back at the beginning of our first session together, where we quoted the Mishnah in Ohalot, where it talks about decapitation. And it says the decapitation, thankfully, is a condition that is definitely considered to be dead. Okay, talking here about animals, not people. If they were decapitated, even if they're still convulsing, they convey ritual impurity. An animal carcass that has been decapitated, even if it's still moving, even if it's still convulsing, is considered to be dead, and therefore it is ritually impure, it is tameh. Okay? And we wondered at the time whether you could say that the brain functionally no longer supporting the body could be considered the same as a brain that is no longer physically attached to the body. That's what Rav Tendler proposed. If so, what might you say? Nowadays we know that even when the brain is not functioning, even brain dead patients don't necessarily meet the kind of standard that Rav Tendler describes and that Rav Moshe echoes here. Coming back to his language here, we know, for example, that a brain dead patient, just because their brain is not supporting respiration, it doesn't mean that, quote, it's lysed completely and its ziph is forcibly severed from the body. The brain is a complex organism. Some parts of the brain can be functioning and others can't be functioning. Some parts of the brain might maintain their structural integrity and others don't. And it's not necessarily clear in any given patient until you do a much more intensive scan what the state of their brain is. And therefore, just to get back to Rabbi Rabin's point, when poskim, when halachic authorities who don't accept brain death as a standard of death read this tshuva, this line is one line that they point to. They point to this line and say, hey, Rav Moshe requires this very high standard of lack of brain function or lack of structural integrity in the brain, that it's lysed completely, that it has complete the condition we refer to as respirator brain, the brain is liquefied, that none of the cells in the brain are functioning. And therefore, if it doesn't meet this criterion, then you can't say that it's considered to be really brain dead according to Rav Moshe's standard. I admit, and everybody who reads Rav Moshe as supporting a brain death standard has to admit that that you would have to modify this line that, again, was written in 1976, when we still didn't have a really good understanding of the state of the brain in patients who are considered to be brain dead. In other words, the research in the past 20 or 30 years would force us to modify what Rav Moshe has written here. But fundamentally, I think it's hard to get away from the fact that Rav Moshe does support a brain death definition, and more to the point, comes out very clearly against saying that cardiac function or cardiac that heartbeat is a dispositive sign of life. It's really inconsistent with this tshuva to say that Rav Moshe considers heart function to be a positive sign of life. So just to get back to Rabbi Radin's question, yes, there is not really a good way to read this tshuva. And if Rav Moshe's important as a posek because of his outsized sense of authority and his sway within the halacha community, then this tshuva is really very problematic for those who don't accept a brain death definition of death. Yeah. This brings us just to a minor point that I want to mention before we get to some of the even bigger perspective questions that I want to get to, which is as much as we're getting into the details here in terms of the examination of halachic issues in a theoretical sense, in a practical sense, halachic discourse in a fairly not really abstract, but a fairly pure sense. Let's not ignore the fact that politics have played a role in this whole discussion as well, which is to say that impulse to push back against new phenomena, given the very conservative nature of halachic thinking and maybe of legal thinking in general, the kind of suspicion that we have of new medical technologies where we're not sure if the medical community is necessarily going to accept what we consider to be acceptable kinds of treatment, acceptable standards of treatment. Let's not be naive in assuming that halacha and medical ethics dovetail on every circumstance. There are lots of cases, for example, in end-of-life care, where there are legitimate and real points of tension between halacha and medical ethical standards, at least in some parts of the world. And therefore, there are again, I call it politics, but maybe it's even more complex than that. There are reasons that somebody would come to this situation and say, let's not jump on this bandwagon right now, even in the face of evidence that Rav Moshe supported it. Yeah, let's leave it at that for now. Rav Moshe's position, in fact, is enormously influential, which is why there's been so much debate over what he had to say, and why these chuvot have been a kind of virtual football back and forth between the brain death and cardiac death camps within the Halakhic community. What I want to close with in the last 15 minutes we have together is thinking about how Rav Moshe's approach is really very innovative in certain ways, and how it can speak to some of the broader issues that are going on, even in the non-halachic bioethical discourse about brain death and about cadaveric organ donation. I mentioned before that Rav Moshe's chuvot are very simple in their use of text. Okay, it's critical in general that a halachic authority ruling on a particular issue not only give a cogent argument, but also square that argument with texts that precede that tshuva. Halakha is a very strongly text-based legal system. Texts that are part of the halachic canon cannot simply be ignored or discarded. And therefore, any posek who's setting out certainly a position on an issue as important this one needs to take other positions into account, and needs to explain how the position they're laying out is not only consistent with earlier sources, but is really well grounded in earlier sources. Has Rav Moshe met that standard? He has, in one very simple way. He's quoted the Sugya in Yoma, the Talmud in Yoma, over and over and over again, and said, based on the Talmud in Yoma, the standard for determining life and death is whether or not the patient can breathe. That is the only source that Rav Moshe quotes consistently as a positive influence on his position. Which is to say, he quotes a lot of other sources. When he quotes those other sources, they're typically sources that need to be resolved or explained away as to why they don't contradict his position, as opposed to actually being a source for his position. For example, when he quoted the Chacham Tzvi, again, an important posek in the late 17th, early 18th century, he pointed out the Chacham Tzvi doesn't contradict what he said, that you can read the Chacham Tzvi as consistent with his position. The Chacham Tzvi is not really a source that he's basing himself on. This kind of decision-making is, in fact, pretty normal for a posek, for halachic authority when addressing a new issue. When poskim start addressing the issue of how to determine death in modern medical settings, and whether a neurological definition of death is halachically acceptable, the very first thing you have to do is start looking for sources. And this is what we did in the very first session together. We looked at these sources, the Mishnah in Yoma that talks about decapitation, then the significance of movement in whether a patient is alive. We looked at this Mishnah in Smachot, which talks about the possibility that somebody might be diagnosed as dead and then suddenly come back to life in an unexpected way. And most of all, we looked at the Mishnah and the Talmud in Yoma, which point to respiration as the critical source. And we said that most halachic authorities and the overwhelming thrust of the halachic discussion relies on the Gemara in Yoma. And therefore, it's not surprising that even though there are other sources out there, the Rav Moshe relies on this one. What's interesting is that he really relies only on this one and doesn't feel the need to ground his position in a lot of other positions in a way that other poskim tend to do sometimes. Okay, here's an issue of style. Poskim who like to quote a lot of sources and poskim who tend to quote very few sources. It's really a matter of personal preference and a matter of how they go about their role as a posek, how much support they feel that they need, how much they feel in need to show how they're consistent with other halachic authorities. Rav Moshe is really very conservative here in terms of just quoting one central source and presenting that as the basis for his position. There are other sources that a person could have quoted as well. And here let's just glance at Rabbi Bleich, who says, hey, where do we know that brain function is actually a relevant factor? Says Rabbi Bleich, the position that irreversible cessation of respiration is the sole determining factor in pronouncing death leads to a conclusion that would be dismissed by everybody as absurd. Okay, and this is the argument that Rav Tendler was parrying, that a polio victim would not be considered alive. And Rav Tendler pointed out, I think correctly, that yes, that's true that a polio patient can't, somebody who's paralyzed by polio couldn't breathe. But for that matter, it's so a person with a heart, with a pacemaker could be determined as cardiac, as dead by cardiac criteria, and therefore let's not just look at one independent phenomenon. Let's look at the next paragraph, however. There is clear Talmudic evidence establishing that cessation of respiration is itself not an absolute criterion of death. The Gemara in Gittin 70b states the physician whose esophagus and trachea have been severed continues to enjoy legal capacity to issue a bill of divorce on behalf of his wife. Such an individual is described as alive, albeit facing imminent death. Okay, it's a kind of gruesome scenario and the kind of the Talmud sometimes comes up with. What happens if somebody's neck is severed? They're still alive and they gesture in a way that indicates they want to give their wife a get, so that they're for various reasons. Can one give their wife a get in this case? The answer is yes. They're still considered to be alive even though they can't breathe. The individual in question is regarded as living despite his obvious inability to breathe. Clearly, the individual in Gittin remains in full possession of his cognitive faculties, otherwise he could not signal his desire to execute a divorce. What about this source? What would we say? We would say, as we said before, that it's true they can't breathe, but the question is why they can't breathe. And if the reason they can't breathe, they can't breathe, but breathing, their ability to breathe is only significant as evidence of their brain function and heart function. And here, the fact that they are still able to function, even though they will die shortly afterwards, means that they can still, they're still considered to be alive. Rabbi Bleich makes also another argument here. He says, nowhere in rabbinic literature is there the slightest hint that consciousness is an indicator of life, or that its absence is an indicator that death has occurred. Rabbi Bleich says, you can't point to brain function as halakhically relevant because nowhere in halachic sources does it talk about the brain at all, or even cognitive functioning. Well, actually, you could point to the Gemara in Gittin as evidence that cognitive functioning is an indication of life. Maybe this is the source that Rabbi Bleich is looking for. But in another sense, maybe he's right? Maybe we need a source to point to say that brain function is halakhically relevant. How does Rav Moshe use the brain and the heart, as an indicator of life if there's no halachic source to rely on? So here's another point that I want to make about Rav Moshe. It's true, he relies on one and only one source as the basis for his position. But he's making a lot of other assumptions that are in fact not well grounded in halachic sources. For example, if we would go back to the source that we quoted earlier, passage that I highlighted and I said is maybe the most important section of this tshuva, it's abundantly clear that the nose isn't the organ that gives life to a person, nor is it the organ on which life depends. Rather, the brain and the heart are the organs that give life to a person and enable him to breathe via the nose. How exactly is it abundantly clear? Where is it abundantly clear from? Is there a source? Does Rav Moshe have the textual basis to say that brain and for that matter, heart function are critical for life? So here's where I think Rav Moshe is really very innovative in terms of the way that he integrates halachic sources, text-based sources, with something else, something that he calls here abundantly clear and one could simply call common sense. In other words, Rav Moshe is saying, we know this to be true. It's kind of obvious. And I would go further in saying that even though he doesn't actually put this label on it, what Rav Moshe here is doing implicitly is referring to modern science. Why is it commonsensical for us to say that the heart and the brain are the main sources of life? Because that's based on the way that we understand the body. Did they understand the body differently back in the time of Chazal? Maybe, maybe not. Probably yes, but let's imagine that it's not so different from ours. And therefore, he says, we can integrate the text that talks about the significance of respiration with scientific common sense, which states that the brain and the heart are the most significant organs in the body. In other words, what Rav Moshe has done is take the basic premise of take the basic premise, the halachic premise that death is determined by cessation of respiration, and integrate that into a modern medical paradigm where we understand that respiration is only an indicator of life and not the source of life. Rav Moshe takes this statement, takes this premise that we determine life and death based on breathing, and integrates that into a modern medical understanding of the body, whereby respiration is significant because of what it demonstrates is going on elsewhere in the body. And therefore, what this tshuva, or Rav Moshe's, these tshuvot, Rav Moshe's approach in general does, is point towards, I think, a broader method of successfully integrating traditional halachic sources and modern science. Sometimes we think if modern science thinks about the world differently, then halachic sources are somehow no longer relevant or no longer speak to us. Sometimes, I don't want to rule out that possibility. Sometimes I do think that's true. But what Rav Moshe does here is he recontextualizes what the Gemara in Yoma is saying and shows how that can make sense within a modern medical context, how we recontextualize respiration within a context where we understand the complex interaction between all of the various processes in the body. And that's why I think this proposal of Rav Moshe, or this approach that Rav Moshe develops here, is really very innovative in terms of halachic thinking. I'll just go one more step in the 2 minutes that we have left and talk about why Rav Moshe, I think, is significant for broader bioethical thinking. And I'm sorry we don't have more time to do this. I left you here with 2 articles. One by Dr. Alan Schumann, who is a prominent critic of the brain death standard in the broader bioethical community, and one by Dr. Alan Rubinstein, who was on the President's Council that adopted or modified the brain death standard during the Obama era. The significance, I think, of Rav Moshe's position is that when you look at the broader bioethical debate, doctors and bioethicists have a really hard time of explaining why brain function should be the determining factor for determining whether a patient is alive or dead. It's true, we think about the brain as what makes us us, right? It gives us our personality, what defines, what helps us interact with the world. But when you think about a more basic level of functioning, as Dr. Schumann points out in this passage that I quoted here, the brain is not actually all that significant after all. What does the brain do to maintain the body? Certain things, hormonal functioning, breathing, but in a lot of other ways, the brain is actually kind of marginal in terms of basic bodily functioning. And therefore, doctors and bioethicists are faced with this question: what makes brain function so significant? One answer is that we use breathing as a definition of what gives of when a patient has life, and that gives a basic benchmark to what brain function means and how brain function is in fact critically significant in terms of the body's function. And this is something that's cited by the last article that I gave you here, which is doctors Amir Halevi and Baruch Brody, who talk about the difficulty that bioethicists have nowadays in defending the brain death standard. I want to stop here because I don't want to go over time, but this is a point where I think accepting respiration as the defining factor in what makes life as the final indicator resolves a lot of difficulties, even though it itself is not a premise that can be defended on absolute grounds. It's a premise that makes sense, certainly to those in the Halakhic community, because of the Gemara, because of the pasuk that the Gemara quoted. But in fact, it actually makes a lot of common sense even to other people who are not part of the Halakhic community. There's something deeply intuitive about the fact that breathing is life, and that somebody who's not breathing is not really fully alive, even if they display other signs of life. And I think that's something that's important to appreciate, and something that can be gleaned from the way that Rav Moshe defends the brain death standard that can be maybe made relevant in a broader bioethical sense as well. Thank you all. I'm happy to stand for a few more minutes if people have questions, and I'm also happy to take questions if you want to contact me via email. I can be reached. I'll put my email in the chat column now. I'll stop sharing screen. And thank you very much.
Thank you. Yeah, and as Reifman is putting his email into the chat, I want to thank him again for being with us. He was in the panel before, and these past three days in these sessions. Reifman, it's always a pleasure to learn with you and from you. So thank you so much.
Thank you.
Look forward to further opportunities. And to everyone else, thank you for being with us these past 3 days. I've learned a lot. I hope that you have as well, and not just learned, but perhaps have been inspired to think towards possibilities of getting involved in applying some of these halachot and these teachings, specifically about organ donation. So thank you. Drisa will pick up again with our spring Zman towards the beginning of February. But over the course of the coming weeks, our yeshiva here in Kfar Tzion is full and running and thriving, and plenty of Torah will come out of Drisa over the coming weeks as well. So thank you for being with us, and to all, have a wonderful rest of the day.